Will I lose my addiction to food? The food will stay longer in the stomach. Dopamine release. Your brain releases dopamine and you feel always happy. Hello, welcome back. The topic today is the GLP1 series. The last videos we talked about GLP1, the pros and cons, and all those things. Now, in addition to that, the one question which usually patients ask after taking GLP1 agonist injections, will I lose my addiction to food? Will the addiction to food will come down? Definitely yes. Even in the last videos, you said the GLP1 agonist injections acts by reducing the gastric emptying. So the food will stay longer in the stomach. So you don't feel like eating or your hunger will come down. So the stomach is always full. Not only that, it can cause gastritis. So when you get gastritis, your body, will have a dislike to food. The same way, a bloated feel. When your stomach is completely bloated, you don't feel like eating. So the same way, when you have a nausea, vomiting, so these are all caused by the GLP1. Any injections like your Ozempic, Wegovy, or even Mounjaro, you feel like vomiting, puking, so you don't eat food at all. And apart from that, the gut brain axis is activated. What is that? So with this injection, the reward system is activated. So the brain gets the reward as if it's been satisfied by the food. So the natural tendency for any craving or even addiction to food will come down. The uh, the the other way is, because of this injection, your leptin, the satisfaction hormone is increased. So you feel happy with small amount of food. So naturally the food intake will come down. The ghrelin, the appetite, or the hunger hormone, so that is also reduced. So your natural hunger has come down. And very importantly, the dopamine release. Your brain releases dopamine and you feel always happy. You mean rewarded. The brain is happy. So the natural interest towards the food can come down. And very importantly, the gastric emptying time is reduced. So that is these are the reasons why people lose interest. But people, now they come after sometimes, after 3 months of injection. Now I don't feel at all, feel at all to eat, or my hunger is completely gone. See, that is the purpose of these injections. See, the purpose of the injection is to lose weight. I mean, and sugar control. So what is the so you cannot eat food and you cannot take calories and lose weight. So the purpose of the injection is to lose interest in the food, not only in the food. In fact, any craving, especially even alcohol, people lose interest in taking alcohol. So when you take these injections, your interest for food will come down. That is natural, and because of that, your sugar and your calorie comes down. So the very importantly, and again people will ask, okay, I have lost so much of weight after 6 year 1 months, 6 months and 1 year. Suppose I stop the injection, what will happen? Probably the effect of these will be remain for at least another 3 months, 6 months. After that, things will change. Probably you will get back your normal appetite, your interest for food will come back, your the metabolism will change. So naturally, over a period of time, after 6 months, they can get back their weight. They may even gain back their weight. So Mounjaro, Wegovy, or Ozempic, the GLP1 agonist injections, the purpose of the injection is to lose weight as well as sugar control by losing interest or taking less calorie of food. But your brain will be little satisfied with that. Thank you.